This is WNYC, FM, HD, and AM New York.
It's the Brian Lehrer Show on WNYC. Good morning, everyone. We'll begin today with a two-part Health and Climate Tuesdays section of the show. Every Tuesday, we make sure to do at least one segment on climate or other public health issues so that they don't get lost among the other, seemingly more pressing or sensational headlines each day. Today, we'll do both. Later this hour, the Queensborough president, Donovan Richards, on the increasingly frequent flooding inside many homes in the borough because of the increasingly intense downpours that the warming climate has been bringing. That's coming up. But we begin with more developments in the last few days in the Trump administration's remake of public health priorities and outcomes. In case you missed it, the Centers for Disease Control announced last week that there have been more cases of measles in the U.S. so far this year than all of last year, about 2,800 so far this year compared to about 2,300 all of last year. More than 90% of those cases appeared in people whose vaccination status the CDC calls unvaccinated or unknown. Just 3% were in those they consider fully vaccinated. 2/3 of the measles cases have been in Americans who are teenage or younger. 7%, or 193 people, have wound up hospitalized with measles so far this year. The CDC records no measles deaths so far this year, 3 last year. Apparently related, the number of families choosing not to get their kindergarten kids vaccinated has risen with Donald Trump and RFK Jr. in office in the last year. The percentage of families opting out for what they call non-medical reasons jumped from 3.6% of kindergartners to 4.2%. Another way to look at that stat, it's a 17% increase in those exemptions, which would be the biggest one-year increase ever. What if this keeps going at another 17%, then another? We may find out soon, because these stats about declining childhood vaccine rates and rising childhood measles rates come just as the new school year is beginning or about to begin in the U.S. And President Trump just nominated someone as commissioner of the Food and Drug Administration who was standing by his side for his recent executive order. Don't worry if you're concerned about these. They don't actually have the force of law. But an executive order that promoted fewer childhood vaccines and breaking the measles, mumps, and rubella vaccine into 3 separate shots. The nominee, Dr. Heidi Overton, has also favored making Medicaid abortion prescriptions harder to obtain, among other things. And interestingly, the New York Times reports that she did run afoul of the Trump and RFK-linked so-called Make America Healthy Again movement by supporting the expanded use of the weed killer glyphosate on the U.S. food supply. We'll talk about all of this now with Julie Rovner, Chief Washington Correspondent for KFF Health News and host of their weekly podcast, What the Health. Previously, as some of you know, she was an NPR health policy correspondent. She is also the author of the reference book, Healthcare Politics and Policy, A to Z, now in its 3rd edition. Julie, always good of you to come on. Welcome back to WNYC.
Always a pleasure to be here, Brian.
Let's start with the vaccine and measles news. Then we'll get to Heidi Overton. We'll play a clip of her explicitly calling for conservative medical research. But on measles, there have already been more measles cases this year in the U.S. than all of last year. Is that simply because vaccine rates are down, or is it more complicated than that?
It's mostly because vaccine rates are down. And in news breaking just this morning, the state of Pennsylvania's public health department is announcing 2 deaths from measles. So the first 2 deaths in the U.S. this year, both in Lancaster County, home to large Amish population, both unvaccinated. Not clear if they were children or adults. It doesn't say. But so, so much for the administration being able to say, well, nobody has died yet of measles this year. Well, now we know that at least 2 people have. So, yes, we are seeing way more measles than we have. And, as you pointed out, the CDC reported last week about kindergartners that more parents are opting not to have their children vaccinated. And we know that basically in order to have what we call herd immunity, so that if one person gets measles, it doesn't start spreading wildly, you need about 95% of the population vaccinated. And in a lot of places, that no longer exists. In Idaho, for example, the entering kindergarten population is only about 75% vaccinated. So there are pockets of the country where, the vaccine rate is very, very low. And that's one key reason why when we see a case of measles, which we always have, occasionally, now we're seeing it spread. It used to be you could, shut that down pretty quickly. Now, not so much.
Obviously, you're ahead of me on this Pennsylvania measles death news, just breaking this morning, as you say. I was going to ask, and maybe this breaking news answers the question by itself, but I was going to guess that if I'm RFK Jr., I might say, look at the stats. 0 deaths this year from measles in the U.S. Maybe he'd even still say, so few, even though cases are going up. Therefore, why risk any potential vaccine side effects? How would infectious disease specialists or pediatricians probably react to something like that?
It makes their heads explode. Measles is a really dangerous disease. Particularly when kids get it, measles can cause encephalitis, which is brain swelling, but it can also impact children's immune systems for the rest of their lives. So it can mess with you in lots of ways. Even if you get the virus and get over it fairly quickly, you can have sequela from having measles. It's really a bad thing, and it's really good that we have a vaccine that is incredibly 97% effective, and it makes pediatricians and doctors in general really, really unhappy when people like RFK Jr. Raise doubts about the safety and efficacy of a vaccine that really, changed not just American lives, but lives around the world for the better.
What is the Trump and RFK position on the measles vaccine? They give such mixed messages. I won't even repeat the off-the-wall things Trump said recently about the MMR vaccine. But here's a short clip from earlier this year at a Senate hearing with Democratic Senator Michael Bennet of Colorado pressing Kennedy.
Let me ask you, are you taking the position, as your CDC director has taken, that the measles vaccine is vital to keeping American children healthy in this country? Are you taking that position today? That has not been your position.
That's my position. We promote the measles vaccine.
So, Julie, do they promote the measles vaccine? Do they promote it and cast shade on it at the same time? How would you describe them on that spectrum, given the answer by RFK and the premise by Senator Bennet that in the past promoting it has not been his position?
Yeah, I like that phrase, promote it and cast shade on it at the same time. That seems to be where RFK Jr. has landed. Of course, he spent much of his career suing the vaccine industry, charging that that basically vaccines cause various problems. And it's not to say the vaccines are 100% safe. There are side effects from some vaccines. Some people have, pretty dramatic reactions to those side effects. That's why in 1986, Congress passed a law to compensate people who have adverse reactions to otherwise, mostly safe vaccines. But basically, the position of RFK Jr. and the president, to some extent, is that parents should have more ability to decline vaccines for their children. And, the president keeps talking about spreading them out. Of course, we know that's, we've tested all of these things. Should you spread them out? Should you give them together? Should you give them separately? Should you wait until kids are a certain age? And basically, the vaccine schedule as it exists now is the result of all of that, years and generations of testing to find out when is the best time to give these vaccines. Should you give them together? Should you give them separately? There's a lot of risks and benefits that get weighed, but they've also been, we, the United States taxpayer, have spent hundreds of millions, probably billions of dollars funding these studies to test these various things. And then we get people who do not have any medical or science background coming along and saying, well, no, we don't think that makes any sense.
Can you talk more about the prevalence of severe side effects from vaccines? Because this is what a lot of skeptical parents who may have no particular political stake in this, or ideological opposition to vaccines, may be asking themselves, well, we hear this generalization from the medical establishment that vaccines are safe and effective, the MMR vaccine we're talking about now in particular, but then we hear something like, well, there can be some extreme reactions in some cases, but we don't hear those stats like we hear the spread of measles stats.
That's right. We don't. And there is what's called the vaccine schedule, or the adverse reaction schedule, where if you have a certain adverse reaction to a certain vaccine, it is assumed that it was because of that vaccine, and there's a no-fault process that you can go through to get compensation for that. So yes, there are known side effects for some very small percentage of the population for some vaccines. So it does exist, and that's why we recognize, and that's why we have this vaccine injury compensation system, which the Secretary Kennedy keeps threatening to change, but he has not yet. But that is really small compared to the public health improvements that we've seen from really, major vaccinations against many, many diseases. I mean, we've almost in... for some diseases, we have had until this year really measles eliminated in the United States. For the most part, we've had measles elimination status. Hepatitis B has gone down dramatically. Things that we now vaccinate against. That sometimes now kids are getting and doctors don't recognize because they've not seen it in their careers. Things like whooping cough. We've had a few cases of tetanus this year. Think that there's no reason for people to ever get vaccine preventable diseases. And if they do get vaccines that do have reactions, and some of the reactions are mild, and some of the reactions are less than mild. But we certainly know after many, many, many exhaustive studies that autism is not something that is caused by vaccines. The first big study that suggested it turned out to be fraudulent. The doctor that conducted it lost his license. It's just been very difficult to get that out of people's brains ever since. It's been 27, 28 years since that happened.
We were talking about the several deaths so far this year from measles itself, and 3 in the United States last year among kids. And so I looked up the stats on, have there ever been deaths from the measles vaccine? And from what I've read, the only deaths from measles vaccines have been in kids who actually were not supposed to get them, severely immunocompromised kids who are officially supposed to not get it, but did by some mistake. Extremely rare, but no other kinds of cases as far as everything I've been able to find on the topic. Are you familiar with that?
Yeah, as far as I know, also that seems correct. As I say, there are some known complications from some of these vaccines, but yes, dying from a vaccine is exceptionally rare.
What do you think accounts for the 17% increase since last year in non-vaccinated kindergarten kids without a medical exemption, the biggest one-year jump in no vaccination among kids without a medical exemption ever recorded? Is it a coincidence that it comes in the year Trump and RFK took office together, or does it seem directly related, or does that sound like too obvious a question?
It's a pretty obvious question. I do think a lot of it comes also from the backlash against the COVID vaccine and against COVID. We have been mandating vaccines for school attendance for generations now since we've had these vaccines. And there were a few people who opted out, as you suggested. There are some people who medically cannot have vaccines. There are some states, and this is decided on a state-by-state basis, some states, you can have religious objections. That's, often what we've seen in some of the Amish populations. About not having vaccines. Now we've expanded these to sort of parents just might say, I don't think I want my kid to be vaccinated. It's not a religious thing. It's not a medical thing. It's just a vibe thing. And since I think the backlash to the COVID vaccine, I think we've seen more parents doing that. And frankly, we now have pretty much an entire political party casting doubt on vaccines. And that's obviously a big piece of this.
I guess when they look back at the COVID vaccine, they tend to say, or they said it at the time too, the opponents of the the mandates in general, and in particular the mandates for kids. They say, well, COVID presented a very, very small risk of serious complications or death among children, much higher among the elderly, but very, very small risk to individual children who got COVID. Therefore, they shouldn't have been mandated. How do you look back at that debate?
Yeah, I think that turned out not to be really true. Now we know that a lot of people, including kids who had COVID, they got over the initial infection pretty quickly, but then they have long COVID symptoms. It may be, I won't say it's exactly, we know a lot about measles after people, recover from measles, but there are suggestions that COVID also, can have complications later on down the line. And there were. I mean, I've talked to a lot of pediatricians. There were a lot of kids who got really sick from COVID, and kids who died from COVID. I mean, yes, in general, it was less serious if you were younger than if you were elderly, but that's not to say it wasn't very serious. I think in the rearview mirror, and I think also since so many people have had COVID since they got vaccinated and therefore had, mild infections, people remember it as less severe than it really was.
I've read that long COVID is now the most common or one of the most common chronic conditions among children. I have a Journal of the American Medical Association article in front of me that says 10 to 20% of kids who got COVID now have long COVID. You familiar with that?
I am, and that's what I was saying. It turned out that those people who said, "Oh, let's let it run loose in the young population and have them give us herd immunity," that turned out to not be a really good idea because we are seeing more long COVID in kids.
Right, and those are big numbers. 10% of kids who've got COVID. You want your kid to have that 10% chance or 20%. They said 10 to 20%, 1 in 5. Part of the mixed messages, and actually I want to open up the phones for our listeners as we continue with Julie Rovner, Chief Washington Correspondent for KFF Health News and host of their weekly podcast, What the Health, as well as author of the reference book, Healthcare Politics and Policy, A to Z, now in its third edition, 212-433-WNYC. I wonder if we have any pediatricians listening right now facing parents of kids entering kindergarten in the last year or few years, and they are childhood vaccine hesitant, or even younger than kindergarten, let's say MMR age. How do you talk to them? 212-433-WNYC. Any pediatricians listening right now facing this in their practice? We talk about stats of increasing vaccine refusal. Make it personal for us if you're personally involved. 212-433-9692, or anyone else for Julie Rovner of KFF Health News on these topics of the new decline in kindergartners who are vaccinated as measured by the federal government, the increase of measles cases to already more than all of last year as measured by the federal government under Trump and RFK, or the nomination of Dr. Heidi Overton as Food and Drug Administration Commissioner, which we'll get to. Call or text 212-433-WNYC, 212-433-9692. Part of the mixed message as the school year is beginning, they in the Trump administration do want states to remove vaccine requirements for entry into kindergarten. This is up to the states. They admit this is not something the federal government can order. Kids can already get exemptions anywhere for religious reasons or medical ones like being immunocompromised, like we mentioned. But here's a clip from this week's Face the Nation on CBS on Sunday, where the host Margaret Brennan had to press Trump's Medicare and Medicaid director, Dr. Oz, to say it's recommended.
The president called that single shot lethal. Do you want to clarify that?
The MMR vaccine is not a lethal vaccine, and it is offered in other countries, the measles in particular, separately, like in Japan.
And they had problems with it in Japan once they started separating things out.
Well, that's the
and it's increased costs. So for like the Vaccines for Kids program that you run for low-income kids, what are they going to do to them?
We're going to pay for the vaccines no matter what. The question, again, this comes back to a much more fundamental issue, Margaret. Do parents have the right to ask questions?
So let's pick that apart a little bit. He did say the MMR vaccine is not lethal. It kind of got lost in all the excuses he was making for not keeping them as a combined shot. But he did say that it is not lethal.
It took 3 tries for him to say that, but yes, he did.
And is that a mixed message? I mean, he's kind of saying all kids, except in those rare medical exemption categories, should get vaccinated. Then he says parents should be able to decide. I guess Oz would probably say it's not a mixed message because he's saying, yes, go do it. Like lots of things to protect your health are recommended. Go do it. They just don't want the government to force you like they don't on most good health practices. So why force them, according to critics of that two-part thought?
Well, what the president's been saying is that he wants, and he's got this idea in his head that the MMR vaccine, which of course protects against measles, mumps, rubella, German measles, is somehow bad to give together, that you should break them into 3 different shots, which means, among other things, more needle sticks for kids. That's not going to be popular among kids or parents. Probably more appointments, so, more time off of work for parents and more time out of school for kids and more appointments for the pediatricians. I mean, there's every reason to not break these up. And as Margaret Brennan was alluding to, they had to break it up in Japan for reasons that had to do with one of the vaccines. And of course, what happened is, predictably, kids started missing out. And I believe it was a whooping cough epidemic that they had as a result of breaking that up. It was a mumps outbreak that they had as a result of breaking that up. And also in the United States, as they were arguing back and forth, there aren't 3 separate vaccines. There's only the one combination vaccine. And the company that makes the vaccine said if they were to break it up, they would have to go through a whole new series of clinical trials and testing. And it would probably take 10 years to break up the vaccine from its current, 3 disease protection into 3 separate vaccines.
We do have some pediatricians calling in per my request. Thank you. So let's go to Ronald, a pediatrician in Nassau County. Ronald, you're on WNYC. Doctor, thank you so much for calling in.
A pleasure, Brian. Yeah, I am actually right now going to schools to do physical exams on kids. And as every school in New York State has a school medical director. And when a vaccine exemption request comes in to the school, it's sent to the medical director to pass judgment on whether it's a valid exemption request or not. Now, we're seeing a massive increase in requests for vaccine exemptions, and there are many doctors out there who are making a business of writing medical exemption requests. So I'm getting exemption requests from as far away as Florida, which really is invalid in New York State, but even local doctors succumbing to parental anxiety and writing exemption requests that do not meet CDC criteria for getting an exemption. And then when I say this is invalid, the parents become very upset and, threaten lawsuits and often send in a letter with the exemption request from a lawyer. And there are law firms specializing in getting threatening schools in order to get vaccine exemptions.
So it sounds like there's a little doctor shopping going on. For one thing, if they can't find a pediatrician where they live on Long Island, well, maybe we heard about one in Florida, maybe in Palm Beach County. So we'll get an exemption request from them. What's an example, especially if there's a common example of a, what's the word? Not phony, but an invalid, what you would see as an invalid vaccine medical exemption request. How do they put it?
There are many of them. The CDC publishes a list of valid exemption criteria. So we get things like Lyme disease, PANDAS, which is pediatric autoimmune neurologic dysfunction secondary to strep. We get genetic things. They'll say the child has a particular genetic dysfunction which is not recognized. Even as silly as things like eczema or migraines. So it runs the gamut, but there's lots of reasons that are put on the exemption form. It has to be a New York State recognized exemption form and a New York State licensed physician. So there is one doctor in Florida who maintains a New York State license so that he can write these exemption requests.
Are there certain hotspots, if you have this broad knowledge of the county, are there certain hotspots within Nassau County, certain school districts or certain communities where the quest for vaccine exemptions is growing the most?
It's across all the schools that I work with 13 different school districts, and all of them are getting exemption requests. It's up to the school medical director, which is myself, to pass a judgment, a medical judgment, whether it's a valid criteria or not. But I don't exclude children. The school administration has to decide to accept my opinion and exclude children. They get 2 weeks in school before they're excluded from school. And some administrators toe the line very carefully and follow the medical advice. And some administrators prefer to look the other way and maybe don't even ask me an opinion. So that varies too from school to school.
We really appreciate you calling in, Doctor. Thank you very much. Let's take another one. Here is a Dr. Emmett in Manhattan who says he's a retired pediatrician. Dr. Emmett, thank you for calling in.
Thank you for having me. I've been in practice for 50 years, so I remember when all these diseases were prevalent. I took care of patients with whooping cough. There was a whole ward in the hospital with babies with pertussis who would cough, stop breathing, have cardiac arrest. So this history gives me a little bit of help talking to patients about vaccines. And I had very few patients. I did have some who demanded different schedules or late vaccines, but the majority of my patients, when I went through the 4-month-old with tetanus, the girl who died of diphtheria, up all night doing spinal taps on kids with meningitis that the Haemophilus influenza B vaccine almost eliminated. I haven't seen meningitis in 25 years. And these are the diseases that people are forgetting about, and they're still out there. So when I talk to them, I've had pretty good success in getting them to vaccinate their children. The other thing is the protein loads of the vaccines that we gave when there was only the old DTP, which had terrible side effects, 104 fever, crying all night, okay? And added to that, when we gave smallpox, we were giving higher protein loads then than if you add all the shots together that we're giving now. So if you take the time and explain this to patients, they generally acknowledge what I'm saying, and I can convince most of them to get their kids vaccinated.
Sounds like you were a good doctor and a good communicator when you were in practice. Thank you so much for sharing that with us. So interesting, Julie, right? Somebody with the benefit of long personal experience who actually saw kids and adults and families in the pre-vaccination, pre-modern vaccination era.
Yeah, absolutely. And I think that's a piece of this is that a lot, today's parents grew up, they were all vaccinated. They have no idea what these vaccines are preventing because they don't remember it. I mean, I'm barely old enough to remember, measles. I actually had mumps as a kid. I remember that. It wasn't fun. So, I grew up after the polio vaccine, but before some of these other vaccines. But I'm in my 60s, and, the parents today in their 20s and 30s and 40s have no idea what these diseases were like. And, as I said, a lot of doctors have no idea what these diseases were like. They're starting to see them now because people are not getting the vaccines, and they're not recognizing them because they'd never seen them before.
So we took 2 calls from pediatricians. I want to take 2 calls back to back. Barbara in Manhattan, I'm coming to you. Catherine in the Bronx, hang in there for a second. From people who are seeing, according to my screener, what they believe to be self-destructive or incorrect reactions to things that are taking place because of the misinformation that's out there. So Barbara in Manhattan, you're on WNYC. Thank you so much for calling.
Okay, thank you. I'm a neurologist, and I was in my neuro clinic in the Bronx yesterday, and I had a very nice patient whose only neurologic problem was trouble sleeping, and he was worried that it came from taking a COVID vaccine, and the way he came around to that was hearing Fauci's testimony, and he thought Fauci was covering something up. I mean, he didn't remember Fauci's name, but he clearly had heard that there was a mysterious cover-up around COVID, and he took that to put together his having taken the vaccine with having insomnia now. I explained as best I could that Fauci was being questioned because he didn't handle the epidemic correctly. It had nothing to do with side effects of vaccines. So the misinformation is like endless. It's hard.
And did you tell our screener that the vaccine that patient thought was causing his insomnia today, that vaccine was 5 years ago?
Well, it was when vaccines first became available and everybody wanted to grab a vaccine for COVID back then.
For COVID, yeah.
Yeah.
By the way, what neurological condition does cause insomnia?
Anxiety, basically. Sleep apnea can. The guy was overweight, but he hadn't taken a test for sleep apnea yet. And in most of my patients, it's because they either stay on their phones too long, or they are worried about other things, or a lot of them. One person is a 24-hour home attendant, and her trouble sleeping is because she doesn't feel like she should sleep when she's taking care of this Alzheimer's patient, and so she has 3 full nights a week where she doesn't get much sleep, and she can't get herself on a schedule the other 4 nights. So it's not vaccine related.
Yeah, and that's a whole other controversy in the news right now, is should there even be 24-hour home health care shifts? But Barbara, thank you for that. I figured, Julie, that about a third of the audience's ears perked up when she said, "Oh, I'm a neurologist and I was treating somebody for insomnia," and then a lot of people go, I have insomnia. Tell me what to do. So thank you for that, Barbara. Catherine in the Bronx, you're on WNYC. Hello.
Hi. Thanks for having me. So one of the things I had said has been happening. I have a son with profound autism. He can't speak vocally. And when I say about a third of the people, if I'm like, oh, he has profound autism, I also professionally work with kids with profound autism. So some people will say, geez, do you think it's caused by, what's the cause? Like, is it the vaccines? Which obviously separately, like PSA, maybe don't say that to somebody with, to a parent who has a child with profound autism because, we might not know. But it feels like it happens about a third of the time. For me, I know the research that you're citing here, so I don't really weigh in on the debate because I don't want to engage. But one of the responses I might give is, hey, let's give into this debate. Let's say it causes it. I don't think it does, but I'll say, well, I'd rather have a child with the needs he has who's alive, who isn't impaired by a major illness. And that tends to shift things. And another thing I find is this argument about, well, in Europe, the rates are lower, and in Europe, they don't have as many vaccines. And, I've spent a lot of time in Ireland. They ban high fructose corn syrup. They ban a lot of pesticides. They ban, food dyes. So their food is, by argument's sake, it might be safer, right? They have a different work-life balance. So I think let's look at the full picture because it's really misleading to just give that stat. Because if you're not looking at the full picture, you might think, well, geez, yeah, that's alarming. But there's a lot of different factors. And also environmental things. So, yeah, sorry. Anyway.
No, thank you. Thank you so much. I really appreciate it. Imagine how hard that must be for her, Julie Rovner, as a parent of a child with profound autism who I guess has, and a somebody who works professionally with children with autism, she said, who knows the actual science and keeps having to deal with other parents in this situation who come with these suspicions.
And there's so much guilt among parents of children with autism or any other disability. It's always, the second guessing of what could I have done differently to prevent this? And in most cases, the answer is nothing. And in the rest of the cases, we're studying it. We're trying to find out. So, so it can be prevented. But piling guilt onto parents is not particularly effective. It's not particularly helpful for anybody. And one of the things we did not talk about yet is, deliberate misinformation and the role of social media and people who are basically using misinformation to their benefit, to attract more followers.
Why would can we not assume that RFK, for example, at least actually believes what he's saying? And if you do assume that and believe that, why would somebody purposely put out vaccine misinformation, which is what I think you just said people do?
People do, because, you can attract. Sometimes people are selling supplements or things that they say can then, ameliorate other things. Sometimes they're just trying to attract attention, to gain engagement on social media, which can actually pay money. I mean, there are financial incentives. It's not just to be a troll, although there are those people too. And then there are people who are just not very well educated, who just like to weigh in. But then there are people who are doing it for financial benefit, who are spreading misinformation for financial benefit. It's a combination.
Do they have lower autism rates in Europe? Is that something that you've looked into?
I haven't looked into it recently. I have looked into, the vaccines, the different vaccines that are required. And of course, they have different health systems in Europe. So it's not, in the United States, we don't have universal health coverage, although we do sort of have universal vaccine provision. That's what Dr. Oz was referring to in the Vaccines for Children program that was created in the early 1990s to at least pay for vaccines for kids who didn't have otherwise health insurance, of which there were a lot. There are fewer now, about to be more. But, it's very, very hard to compare what happens with the health systems in the United States and in Europe because our health systems are so different. You can't just split out the vaccine requirements. And also, different levels of vaccine preventable diseases in some of those countries. So it's
one other vaccine thing before we go on to the new Food and Drug Administration nominee, Dr. Overton. I read this morning that this is a good time of year to get a COVID vaccine for people who want them for fall indoors events or school or whatever, or even the summer uptick that's happening. But this year's COVID shot is not available yet in many places, so anyone seeking a vaccine now might wind up getting last year's version. Do you know that to be true, or if there's anything with the administration that would be delaying the rollout of an updated COVID vaccine compared to previous years?
I believe the FDA has approved this year's COVID vaccine. It has not been through the CDC. What happens is the FDA licenses it and then the CDC recommends it. And the CDC hasn't recommended it yet because, as we know, the Advisory Council on Immunizations is basically on ice right now. Robert F. Kennedy Jr. redid it, and that was blocked by a judge, and they're talking about redoing the charter and redoing it again. But I am not. I also saw that report and have not yet looked into it although it's a little bit early to get fall vaccines. There's, at least with the flu vaccine, it wears off, and even though drugstores and grocery stores will say, get your flu shot now, you really should. Most doctors say get your flu shot in October rather than right now.
Flu by boo, some say, right, by Halloween. How different would a 2026 COVID shot be from a 2025?
That's what the FDA and the CDC, look at, sort of what's circulating. What are the strains that are circulating? It's true for COVID and for flu because they both change a lot. And so I believe there is a COVID vaccine, as I say, that's been licensed by the FDA for 2026. But I'm not sure. I saw that when they did it. I think it was back in the spring. But I know there are still issues. And we have a brand new CDC director who was literally just sworn in last week. And we're going to wait and see what she says about various vaccines.
We'll continue with Julie Rovner from KFF Health News in a minute and for another few minutes and turn to President Trump's nominee to lead the Food and Drug Administration, Dr. Heidi Overton, known as an opponent of abortion access, also of gender-affirming care, and of vaccine requirements for school children. What might she actually change if she is confirmed? One Republican senator whose vote she would need says he has serious doubts. But he usually says that before voting yes anyway. Some of you can already guess who that senator is. We'll explain and play a clip of Dr. Overton after this. Brian Lehrer on WNYC. A few more minutes with Julie Rovner, Chief Washington Correspondent for KFF Health News and host of their weekly podcast, What the Health. She's also the author of the reference book, Healthcare Politics and Policy, A to Z, now in its third edition. Okay, Julie, healthcare politics from A to Z includes the letters FDA for Food and Drug Administration. Trump's last FDA commissioner, Marty Makary, resigned in May. He was controversial for various reasons, but I've seen reporting that said the issue that led him to leave or be replaced was Trump's insistence on approving flavored vapes, which Makary opposed because of the risk that it would entice young people, children, minors, to pick up the habit, which is often described as an epidemic among youth, vaping. How accurate is that as to why he left, if you know?
Well, that was what he said in his resignation letter. So, it was a difficult tenure for Marty Makary. That may or may not have been the last straw, and he may have, been pushed a little bit as well as left. But I mean, there was a big debate over vaping and over these flavored vapes, and whether or not we should be pushing vapes as a safer alternative to smoking tobacco, and what the risk is to young people. And for a while, it seemed to be sort of the compromise was we could have vapes that, tasted like tobacco or menthol, sort of the traditional flavors of cigarettes, and that those would be replacements for smoked tobacco, but wouldn't be, fruity flavored to attract kids. And then the vape industry lobbied the president himself and the White House, and there was a push, and eventually the flavored vapes were also approved. So I mean, it was a legitimate big fight, and there were people on both sides of the argument.
Do you know why Trump did seem to take such a personal interest? I mean, he was out there saying things. Why he took such a personal interest in promoting flavored vapes? I understand that officially they were only approved. He got them approved over the head of FDA Commissioner Makary, and approved only for adults, though we know kids get access, but teenagers under, I don't know if it's 18 or 21, approved for adults, but obviously access is available. Do you have any idea why Trump himself seemed to take such an interest in promoting vapes?
Well, it is well known that if you can catch the president's ear and, convince him of your argument, that he can sometimes side with you. And that appears to be what happened in this case, that lobbyists, got to him. I believe it was either at Mar-a-Lago or on the golf course. I can't remember exactly, or probably on the golf course at Mar-a-Lago, and convinced him that this would be a good idea. And he is, as we have seen with other things, he can be convinced of these things. That's been sort of the line, that it's the last person to be in his ear whose side he's going to take.
So Trump, not just for vapes in general, but flavored vapes. The new nominee is Dr. Heidi Overton, who was already a Trump domestic policy advisor and had been with the America First think tank. Here she is calling, apparently, for more conservative medical research.
We need publications in academic journals that are conservative-based. We need research funding that is willing to say, no, let's fund these type of studies. That's not happening at the NIH. The FDA isn't prioritizing those kind of decisions. The CDC certainly is not. So all of those agencies have to be reformed in how they fund and prioritize.
What does that mean? Publications in academic journals that are conservative-based that's to say there should be a political ideology in scientific research and reporting on it.
Yeah, it is not a thing. I spent a lot of time after she said that I saw a lot of eminent scientists pointing out that is not a thing, conservative-based research. I would point out, I've been doing this for 41 years now. Biomedical research has been, for almost all of my career, extremely bipartisan. It's something that Democrats and Republicans believe in, that you go where the science takes you, that this is not ideological. Of late, we have seen more ideological sort of, I hesitate to describe them as quasi-science, but they are certainly they follow ideology more than they follow the science, let's put it that way. And I suspect that's what she was talking about. And yes, are scientists sometimes too set in their ways, and maybe you need to look at some things that you might not have looked at otherwise? That can be good science. But are you looking at something because you have a pre-existing belief that's not based on science? That's not science, that's ideology. And, there's a lot of mixing of those things right now. And as I say, social media is not helping. And people who don't have a science background, but who are profiting from trying to spread disinformation or misinformation, or just say, well, my common sense says X. It's like, well, that's not what the science says.
Like McCary, she is known as an opponent of the current abortion pill access, especially availability via telehealth, and of vaccine mandates for school kids. What, if anything, might make her different from how McCary led the FDA, other than, the vape issue, which I guess is now resolved? Just real quick, because we're running out of time.
Well, like McCary, she is a doctor. She is from Johns Hopkins. McCary, I should say, was not necessarily an opponent of the abortion pill mifepristone. In fact, he was accused by anti-abortion activists of dragging his feet on studying that. So one would assume that she would not do that. But, she's a really interesting nominee, because it seems that in her work at the White House, she really was trying to kind of smooth things over for both sides. So she has both support and opposition from kind of all sides of the MAHA movement and the anti-abortion movement and the public health movement. So we're going to have to see what comes out in her, nomination hearings and what happens with this nomination.
And the senator whose support she will really need, MD himself, Bill Cassidy of Louisiana, because apparently she needs all the Republicans on the relevant committee, because the Democrats are going to vote against her, in order to put the nomination through to the full Senate. And we know Cassidy's history, particularly with RFK Jr., who he was very skeptical of in Kennedy's confirmation hearings, especially over the vaccine issue. Dr. Cassidy is a supporter of, vaccines according to the known science, and was skeptical of Kennedy, but then he voted for him anyway. I think at this point he feels kind of betrayed in terms of the promises that he thought he elicited from RFK Jr. in that confirmation hearing. And he's saying the same kind of things now about Dr. Overton. Well, I'm skeptical of her. There are things I don't think are right, but I haven't decided yet how I'll vote. So do you have a Bill Cassidy take? Oh, and by the way, they primaried him anyway. and
he lost.
He lost. So this is going to be one of the last things he does in the United States Senate as somebody overwhelmingly concerned with public health issues. What's your take on Bill Cassidy here? Then we're out of time.
I thought you said he would. By the way, he was on our podcast a couple of weeks ago, where he did say he felt betrayed by Kennedy. But yes, I think you're right. He tends to say, "I'm very skeptical, I'm very dubious," and then in the end, he votes yes. I would be surprised if that's not what happened this time too.
Julie Rovner, chief Washington correspondent for KFF Health News, and host of that podcast called What the Health, author of Healthcare Politics and Policy A to Z. Thanks so much, as always, Julie. We really appreciate it.
Always a pleasure, Brian.